Welcome back to my channel, Running in Rehab. My name is Brett. I'm a 234 marathoner and I'm a third year physical therapy student. Today we're going to talk about if you're having front of the hip pain, especially while you're sitting. We're going to talk about why that is and how to fix it. So let's talk about a little bit of anatomy and then we'll get into the solution. But what's going on is when you're sitting like I am now, your glutes, so your glute maximus, your glute medius, your glute minimus, they all become internal rotators when you're sitting due to the line of pull. And I'll put up an image here just to kind of show you guys, because a muscle can only shorten. So if you look at the fibers and the line of pull, what's going to happen to the femur? So let's say this is your pelvis, this is the socket, your femur is going to internally rotate, okay, which is fine. But if that becomes excessive, you could see how that could start to impinge on the labrum or maybe some structures when you rotate forward. There's two muscles on the front of the hip that you should be aware of. One is called your tensor fascia lata, and that one is a flexor, so it can flex your hip. Like bring your knee, like a march, bring your knee up towards your hip. It can flex your knee, and it also internally rotates as well. So if that's stiff, now we're just contributing more to internal rotation. And then another key muscle to be aware of if you're a runner that's likely stiff on you is your rectus femoris, which is one of your quad muscles, but it flexes your hip. And if that's stiff, now we're coming into flexion. So we're getting a lot of internal rotation in the socket and we're getting flexion in the socket. So if you're getting pain in this kind of area that I'm describing, kind of the front of the hip, maybe a little high in the socket, but you feel like that internal rotation, flexion, impingement on the labrum, this is the video for you. Let's talk about also the role that the hamstrings play. We see a lot of runners with hamstring stiffness, and what can happen there is the hamstrings actually originate from the pelvis, an area of the pelvis. So we'll go back to this is the socket, and then your pelvis is over here. Your hamstrings attach right on the ischial tuberosity, so on the bottom of the pelvis. Meaning, if they're stiff, they can pull the pelvis downward, right? So if they're pulling the pelvis downward, and we come back to the femur, right, and this is the pelvis, right, this is the socket's on the pelvis, and that's pulling downward, and now we're just jamming even more. To add a little bit more insult to that is we're in a seated position like I am now, so our ischial tuberosities, right, where the hamstrings attach, it's also our sit bones. That's where we're sitting, wherever you sit. You're on your sit bones, and that's going to push the pelvis up as well. So it's kind of a compressive force pushing the pelvis, kind of just jamming that femur up even more when you're sitting. So I hope you guys are still with me so far. The solution here is to activate your deep external rotator muscles. They're the only muscle group that's going to bring your femur back into the centralized position of the socket. Like we just talked about, all of these other muscles are jamming you forward, internally rotating and jamming you upward. Your external rotators can help to bring you back centrally into the socket. So this is a group of deep muscles. Kind of think of them as your rotator cuff muscles of your hip. You want to do some activations of these muscles before your runs and before you're sitting, and just really strengthen these muscles to help stabilize the ball and socket so you're not getting this hip jamming pain. Because as runners, especially after a longer run or a harder effort, our muscles get filled with waste products that tend to decrease elasticity of the muscles and stiffen the muscles. When our glute max is stiff and our tensor fascia lata is stiff and our rectus femoris is stiff, like we talked about, these muscles all contribute to that internal and flexion rotation of the femur. The femur is not sitting centrally in the socket. So we're kind of jamming up against the labrum, jamming up against other tissues and structures, and that's what could be causing our pain. So again, to fix this, we want to do slow, controlled, easy movements, exercises like side plank clamshells or side lying clamshells, slow, controlled to activate those deep external rotator muscles. If we go too hard and we push too fast with the tempo, our body is just going to contract whichever muscle group contracts quickest and easiest. So it may just contract the glute max, right? And that's likely what's going on when you're running. These muscles, the external rotators, are likely just lying dormant, not doing their job as efficiently as they should, and you're likely just using glute max or some other big muscle to stabilize your hip, which isn't really that efficient for stability of your hip or efficient for your running in general. So really good idea to check this out for yourself and see if you can activate those deep external rotators. And then, of course, the other side of the coin is you want to stretch the muscles that we talked about. Stretch your glutes, stretch your TFL, stretch your rectus femoris, and see if your pain goes away. I look forward to seeing you guys on the next one. Like, comment, and subscribe. Leave any comments down below of any questions or what you want to see next, and I'll see you guys on the next one.